we have the famous Dr. Mameniskis here with us today. So we are very, very excited to have him. Everyone say hello.
Hey everyone.
So Dr. Mameniskis, before we start actually answering the questions that you guys are asking, and feel free guys to ask any questions that you may have, let's talk about some common questions, some frequently asked questions that you typically would get. So one of them for sure is, what is a mommy makeover?
A mommy makeover is a rejuvenation for a woman's body after childbirth. It generally involves a tummy tuck, which is removal of the excess abdominal skin, tightening the muscle, doing some liposuction of the flanks, and doing something with the breasts, whether it's breast lift, breast augmentation, or both.
Fantastic. And what is the typical healing time for a mommy makeover?
Mommy makeover, 3 to 4 weeks. Get back into light work or some activities, more than being sedentary, and 6 weeks for no restrictions for anything.
And what is the time for the procedure? How long would a procedure take?
The procedure in the operating room takes around 4 hours.
Okay, 4 hours, great. And now what's the difference between the time it takes for a mommy makeover versus a BBL?
It's about half the time usually, because mommy makeover is essentially 2 procedures that take 2 hours, whereas a BBL procedure usually takes around 2 hours.
Around 2 hours. And what would you recommend for someone who doesn't really have too much information about what a BBL takes in terms of post-op?
Post-op, well, set up a virtual consult.
Nice.
Or an in-person consult if you can come nearby.
Even better. And what's the healing time typically for a BBL?
2 to 3 weeks.
2 to 3 weeks. And how long is it that they're not supposed to sit after
3 weeks.
BBL? 3 weeks, okay. Luckily, guys, you guys have those BBL pillows, but with the free consultation, you can get more information on that. Now, for those of you guys joining, we are here with the famous Dr. Mameniskis. So if you guys have any questions for him, now would be the time to ask, okay? Ask away, because this would be the perfect opportunity. Now, do you recommend for someone who has just had a child to do the mommy makeover?
I recommend that she thinks about it, certainly, and sort of see how your body changes, think about whether you want to have more children, in which case I would not do it, and wait for at least 6 months to have everything sort of stabilized.
Okay, so 6 months is the typical minimum waiting time. All right, what about someone like me who wants to have twins? How long do I have to wait?
What, to have twins?
Yeah, I want to have twins instead of like one baby. So I can have 2 in 1.
Okay.
Special deal.
You want to wait for what?
For the surgery. How long?
Which surgery?
To do a mommy makeover.
Well, you don't need it.
So Dr. Mameniskis.
We'll talk about it in a few years or something.
Yeah, Dr. Mameniskis is with my hypothetical question with twins. Says I don't need it, so I believe him. Now, the girl with game, I have wanted to do my body for 5 years. Well, that's fantastic. Now we have Dr. Mameniskis here. So what do you want to have done? Feel free to ask away. Now, we had a really good review from you, Dr. Mameniskis, by, I believe her name was Amanda.
Okay.
And she was very, very happy with her results. She actually had twins, so I did your testimonial with her. And she was very, very excited. What would be, for example, the perfect candidate for a mommy makeover?
Someone who's, once again, those prior things we talked about, more than 6 months postpartum, needing it, thinking about it, not wanting more children. And being a proper BMI, which is 35 or below, and being in good shape, fit. Yeah, those are most of the things. Yeah.
And what's the highest BMI do you use?
We don't like to go above 35. Sometimes we do. If the skin is not that thick, then there's less chance for healing issues. If it's much higher, there's more chance for having healing issues.
All right, fantastic. And we have Gigi who has a question here. How's recovery for rib remodeling?
Rib remodeling. I'm not sure what they're talking about. They're probably talking about fracturing ribs to give more of the
slim
corset
waist look.
Yeah, I really could not answer that.
Have you ever done that?
I've done it in reconstructive type situations.
Oh, in order to use the cartilage?
Yeah, similar, but not right now.
All right, Gigi, definitely re-ask your question because we do want to answer you. But we want to know if you're talking about that corset look that he
I think
mentioned.
she is, yeah.
Yeah, that way we know. Now, what is a strange speaking of not so usual procedures,
Oh.
do you have any other procedures that are like most like that you would say?
Thought that I don't perform that frequently,
Yes.
or well, let's think.
We'll give you some.
Well, maybe some of the facial procedures, not as often. Maybe an otoplasty, I don't do as often. Buccal fat removal, I do it, not every day.
Oh my God, I did have a question because
Mhm.
I did see a really cool UFC fight over the weekend.
Okay.
And I had a question. Can cauliflower ear be fixed?
It can be improved. It's very difficult
To
because
fix,
the
right?
tissue is so thick and so much scar tissue there. So you can improve it. I'm not saying it's going to look like the
Pre-fight.
boxing ear, but yeah.
So, because I know we were talking about rib
Mhm.
cartilage being used for like a
Right,
rhinoplasty.
yeah.
So, is it possible to use it for the ear as well, or?
We use it for the ear sometimes in some reconstructions, but in that situation, no, you would not use it.
Impossible.
Well,
Yeah.
it's more scar tissue. Yeah.
So we have Gigi who said yes, it's the corset look that she's talking about.
Okay. You have to talk to your practitioner who's confident doing that procedure. That's something I don't do. But if it does cut the rib, it's going to hurt a long time. Ask anyone like me who's ever had a broken rib. It's 2 weeks of hell,
Really?
and then it stops.
Okay.
Yeah.
Well, Gigi, you might want to triple think about that so that you are not in.
I mean, people do it for sure, but
pain.
seek someone who does it well.
Okay, fantastic. All right, so do we have any other questions now that we have Dr. Mameniskis here, guys? You know he doesn't really come on the lives that often, so if you have any questions, now would be the time. All right, feel free to ask away. Now, speaking of facial procedures that you don't really do too often, you do rhinoplasties
Yes,
often.
I do actually, yeah.
And do you like the rhinoplasty?
Yeah, I do. It takes a lot of this sculpting. It's like being a sculptor to some degree, and it's different geometric wise than the rest of the procedures I do. I really like it. Different types of tissues, mucosal, bone, cartilage. Yeah.
And when would you need to remove some of the rib cartilage, for example, for the rhinoplasty?
For a dorsum that's very, very flat, this part of the nose, the bridge of the nose,
okay.
it's very, very flat. You need to use that cartilage to build it up and give it more height.
Like most African Americans don't have that, right? So that's why
Some
you
don't.
would need
Some
it.
don't. I'm doing one tomorrow who does. So
Oh, nice.
who doesn't need
Okay.
it kind of.
Fantastic. All right, guys. Well, do we have any other questions for Dr. Mameniskis while he is here? Let's ask away because he is not usually on our live, so we're so lucky we have him here. So if you guys have any questions, now is the time to ask. In the meantime, let's ask one final question. For the BBLs, is it possible to get a skinny BBL?
Yes, absolutely. I mean, skinny BBL is usually one that's done on someone who's very, very thin, and the idea is to take someone who's very, very thin and straight up and down and give them curves. That's what it is.
And what if the patient is too skinny? What would you recommend as too skinny?
Too skinny, really. I mean, you can try to safely gain some weight. Talk to your primary care doctor. Don't do it unsafely. It's going to be bad for your health. You can do it with certain protein supplements. If you can gain a little bit of weight, some patients have been able to do that, maybe for like 5 pounds. As far as the BBL is concerned, there is another accepted option. It would be the butt implants. They're solid silicone implants. I've done quite a few of them. The recovery is very specific, and if you follow the rules, you'll be okay. If you don't, I've had some problems with
It'd
them.
be a different story.
Seromas infection, yeah.
So we have Chocolate Monkey. If you can please re-ask that question because I'm not sure. Are you asking that because that's what Dr. Mameniskis did? I just want clarification before I verbally say that. Now, for someone like Shiny19 who doesn't know, we are located in Miami, Florida. And we have 3 locations here. And luckily, I am with the location where Dr. Mameniskis is. Okay, so for those of you guys
That location, yeah.
For those of you guys who don't know, what's the location here for everyone that wants to know?
That location. This is, we're at Flagler.
All right, so we are at Flagler, guys, just so that everyone knows. And then most importantly, if you guys would like a free consultation, please ask for Dr. Mameniskis. We have it here on the screen so that you guys can know how to spell it. But most importantly, if we do not have any other questions, we'll let him go because he is booked and busy. He is busy with you guys. So I actually got him on his little lunch break. So I'm hoping that you guys are able to book that free consultation. So we have a very special, a very special live with Dr. Mameniskis, guys. Thank you so very much.
See you guys. See you next time.
See you soon.
Have more questions.